Hello and welcome back to Coffee Time with me, your host, Dr. Suarez, here at Behind the Scenes 941. Today we're going to talk about something that was brought to my attention when I was at a conference a couple weeks ago with the Florida Academy of Cosmetic Dentists. And given the fact that yesterday was Suicide Prevention Day and today is 9/11, it's obvious and evident that we all have struggles, we all have things that we deal with on a daily basis, and it's no secret that dentists have always been thought to have a high suicide rate. So of course, this was a serious conversation, and it seemed so obvious to me because it's something, not suicide necessarily, but anxiety and stress related to the occupation. It's something that seemed so obvious. I feel like I talk about it all the time. But one of the things that hit home for me the most was that when Dr. Kyle Stanley was up there and he was talking about it, he said, we don't talk about this enough. And it's true. We go to these meetings and we learn about dentistry and we learn about all these amazing dentists and the stuff that's out there that we all want to do. We see everybody's best foot forward, and it also at the same time makes us feel like we're inadequate, right? And maybe frustrated, and all the things that we normally have to deal with: stress, anxiety, depression. Because yes, we do feel everything that our patients feel. We understand that our patients are nervous to come see us or don't want to be in the dental chair. I mean, I can't tell you how many times a patient tells me, I'd rather be having a baby than be here. And there were some really interesting facts that he put up there, not just about the suicide rate among dentists, but all the dealing with patients' anxiety, how patients would fear going to the dentist more so than fear death. Those kinds of things. And then we work in close proximity and we can feel if you're nervous, if you're shaking, if you're in pain, and we carry that with us all day long. And it's not just for dentists, it's for a lot of other professionals, or for moms, stay-at-home moms, people that have maybe lost a loved one, something like 9/11, people that are living with that tragedy. There's so many things. We all have things that we're dealing with and struggling with on a daily basis. So what am I getting at? The point is, we do need to talk to each other, and we do need to talk about this. We also need to have sympathy for each other. Somebody comes up to you and is sharing something with you. How many times are we quick to say, oh, well, that's not so bad, or, what are you so stressed out about, or whatever. We even do it to ourselves. We tell ourselves, oh, get over it. Get over it. It's not a big deal. But it is a big deal because your body still perceives it as stress, right? Whether it's I broke a nail or I don't have money to make my house payment tomorrow, stress is stress, and it still physiologically has the same response. So listen to each other. Talk to each other. Talk about it more often. We need to understand that it's not something that we should be ashamed of or embarrassed about, and it's not a weakness. Some of the strongest people, or the most famous people, or what we perceive as the most successful people, struggle with this the most. And we always assume that their lives are fine, that they have no problems, and that they have nothing to worry about. And then look at the result and how surprised we are when something happens to somebody, or somebody does commit suicide, how completely and entirely surprised we are. And nobody knew about it. Nobody at all knew about it. They had nobody to talk to. They had nobody to discuss this with. It was completely hidden. So share with each other. And remember that it's not a weakness. It actually makes us beautifully human.